everyone. It is time for another great show. It's Friday. It's July 1st. Going fast. Half the year is already over. It's 74 degrees in Kitsap County. So glad that you can join us for our conversation today. We have Kitsap Public Health District with us today and our guest, Dr. Gib Morrow. Let me go ahead and bring him forward. How you doing today, Doc?
I'm good, Marwan. Thank you. That's the biggest round of applause I've had in a couple decades. I appreciate
it. Well, we got some updates to our studio, so we gotta make sure that you give you all the applause that is due. How you feeling?
I'm good. It's a beautiful day, and we got a 3-day weekend coming up. We're just coming off an interesting month, Pride Month, where we honor the efforts to achieve equality and equal opportunity for LGBTQ people. Juneteenth, really important new national holiday, one that was celebrated by the Kitsap Public Health District for the first time. And now rolling into our weekend of celebration of our nation's independence. And so it's a beautiful time. It's not perfect, but it's a lot to celebrate.
Yeah, absolutely. Did I see you at Juneteenth?
No, we celebrated that in a variety of different ways, but I was not down in downtown Bremerton for that.
Yeah, I thought I saw you. So there were so many people there. It's like, oh, hey. So, there's so many things that we've got something specific to talk about, but I did want to ask you, was there anything that you wanted to share about Kitsap Public Health overall? Heat advisory type things or food things. Like there's Kitsap Public Health does a lot of things.
Couple things. Pediatric vaccinations are available for all kids 6 months of age and up, and I think that they're widely available. I know a lot of parents are going to want to talk it through with their pediatricians. Just with respect to what's going on with COVID amongst kids in Washington State, those first couple weeks in June, there were almost 7,000 cases identified, and in kids. That's amongst children and youth in just a 2-week period. And we know that we're really only picking up about 1 in 5 or 6 of those cases. So case rates are still pretty high. They're highest in the 0 to 3-year-olds. Kids are still getting hospitalized, 48 in kids just in that 2-week period. And so we do encourage parents to get their young ones vaccinated. A lot of reasons for that. And they should be available. We're hosting clinics through the Kitsap Public Health District. I encourage parents to take advantage of that as an important opportunity. Yes, we've got some new plans in place for heat events, and we do that in conjunction with the Department of Emergency Management, setting up and running cooling centers. We've got some protocols in place. Hopefully we're not going to get too hot this weekend, but that's all good to go. And I think those are kind of the main things I want to get out there. The other thing I want to talk about is, and thank you for attending. We had that community conversation Thursday over at the Health District, to which we invited people that had participated in the Equity Collaborative, which was really initially stood up in a response to trying to get underserved and minority populations vaccinated. And we're trying to evolve that whole group of people, expand the partnerships, identify different areas of collaboration to help address some of those equity issues, which are just of huge importance in public health right now. So I'll leave it at that. But
well, let me ask you 2 things. One, what was kind of your takeaway from that event you hosted the other day?
Yeah, I mean, I guess my takeaway from that event was that we got a lot of work to do in a lot of different areas, and we've got a lot of different community partners who are doing different things. We really need to fully understand where those gaps are. The access issues, I think, are real. There was an interesting article put out from the CDC just today, which shows that communities and counties that have easy access to a pediatrician or a family physician are twice as likely to get their kids vaccinated as communities that don't have that access. And we're aware that in Kitsap, we don't have great access to primary care. We're seeing in our emergency departments 35% increase in emergency visits. And a lot of that is probably attributable to the fact that people don't have really easy available access to primary care physicians. The numbers that are of docs on a per capita ratio are lower in Kitsap than they are in the state as a whole. And the state as a whole is a little bit lower than the nation as a whole. And that's based on some information coming out of the county health rankings, which we're trying to get our heads fully around and make sure we understand the data and the limitations of the data. But it does look like we could stand to have better access in general. We know that access to mental health services is a huge issue. That's true not only in Kitsap, but also statewide, nationwide. And marginalized populations, people that don't speak English, people that are coming from disadvantaged communities, people that don't have the economic resources are always going to have a harder time getting in. We do have in Kitsap, fortunately, a really wonderfully well-run and effective federally qualified health center taking care of folks that have Medicaid and lower economic resources. And we're really grateful to be able to partner with Peninsula Community Health Services on a regular basis.
All right, nice. Replying to Kitsap Public Health District, I'm taking my youngest next week for his booster. My oldest got her booster at the health district, and the nurse was awesome. All right, I like that. So shout out to that. Now you were saying, Doc, did you say 48 children were hospitalized in the last 2 weeks due to COVID?
That's what the latest state report says. Yeah, it was published, I think, just a day or two ago, coming out from Department of Health, and that's I can pop that resource in the chat box for you if you want it.
Yeah, that'd be awesome.
Yeah, I was surprised to see that as well, but it's and I think it's let's see, I've got a private chat box with you here. I can just pop it in there, I guess, Marwan.
Yep, that's perfect. And then I'll pull it up. And is that the BA4 and BA5?
I think those are starting to comprise about half of what we're seeing, if not a little bit more at this point. So Omicron continues to evolve. I mean, this virus in general continues to morph a little bit. It's hard to imagine that it can keep getting more transmissible than it already was, but that does appear to be the case. And so that was just from a couple of days ago. And if you scroll down a tiny bit, you'll see their kind of summary statements there. And I was just looking at those as right before our conversation. But, not all of those hospitalizations may be caused by COVID. Some of them may be incidental. Kids who get hospitalized for another reason altogether, but just who test positive. But it's still concerning that those hospitalization rates appear to be increasing.
Definitely, just goes to show that the COVID is not over.
It's not, and but it's getting something we know how to live with, and it's good to see people out and about, and people coming together in different places, and with the protection that people have from getting vaccinated, boosted, infected, reinfected, and all the different combinations of the above. I do think that it's going to become increasingly, less of a concern and more of a common cold. But those who are unvaccinated or haven't had prior infections are still a pretty significant risk, which is why you want those kids to get vaccinated.
All right, absolutely. Well, thank you for that update. I love resources. So, again, that is in the chat. If you guys want access to this information here, that is on the screen. Yeah, thanks, Doc, for that update. So, let's get into our conversation today. And you were going to come and talk to us about adding to the board, correct? We briefly touched on that before. I think you muted yourself. I think we briefly touched on that before, but today we're going to go into a little bit more detail.
Yeah, so the reason that we are increasing and the size of our health board and adding non-elected representatives is because a state law, ESB 1152, was passed last year, which requires that of all health boards. And that was done in response to a lot of the political fallout that was occurring on health boards across the state, I think. It was driven by that. The outcome is that each county health board of the size of a county like Kitsap that doesn't have a public health advisory committee is required to have equal numbers of non-elected and elected representatives. And those non-elected representatives are appointed by the Board of County Commissioners and need to come from 4 different groups. So if a county has historical and current tribal nations that are within the county borders, tribal representatives are requested to be present on the health board. And the American Indian Health Commission is helping identify representatives from the 2 tribes that are in Kitsap, which will fill out 2 of those positions. And the other 3 positions come from 3 different buckets, one of which is public health and healthcare representatives. So anybody who's currently engaged in medical practice, there are certain licensing requirements and or public health workforce people that are interested and or available for work on the board. And we've received over 39 or 40 applications. The vast majority of those were for that public health healthcare bucket of work. And so we've been working through those and have done some interviews and are in the process of making some recommendations to the county commissioners with respect to which of those candidates will be recommended. And that's by the personnel committee of the health board. So that's comprised of I think 3 of the members of the Board of Health. And so those interviews are ongoing as we speak. The other 2 buckets are community stakeholders, and that's a pretty wide range of organizations. So people that are coming from just a community-based organization, a different partner agency, really almost of any sort, but the kind of groups that we work with frequently would be housing or maybe and the list is on there. I think it's a broad list on that website. And then the final group, and the one that we're really trying to kind of cast a wider net for, are those people who are considered to be customers of public health. And that's, again, a big bucket of folks. But what we're really looking for are people that have received public health services in the past, things like assistance, with the nurse family partnership programs, or people who are living with HIV might have received care management services through our group, really trying to use that category to try to find some different voices from the community that reflect the views of people that are, have had some struggles in their life, people who have been maybe incarcerated or on food stamps or what have you. But we're really trying to get some more folks to throw their name in the hat for that position, because I think that would add a really valuable perspective to a lot of the policy decisions and bring some diversity, make our health board a little bit more inclusive. So when all's said and done, we'll have 5 new health board members, 2 from the tribes, 1 from healthcare public health, 1 from a community stakeholder organization, and 1 who's a customer of public health. And they will be joining the 4 mayors who are on the board. So the mayor or the mayoral representative from Bainbridge, Port Orchard, Bremerton, and Bullsbo. So those 4 mayors will still be on the health board. And then the county commissioners are going to pick 1 of the 3 of them to remain on the health board. The other 2 will have the opportunity to kind of rotate back in the future, but it'll be down to just 1 county commissioner, 4 mayors, and then 5 non-electeds. And that'll be the new health board. And we're looking at having people in place this summer and good to go in September, which is when we're going to be doing a new strategic plan at the health district. We're going to be trying to really identify what are our priorities, where do we want to be focusing our efforts.
So why don't we do this, Doc? So, I like to think of myself as a pretty smart guy, but this could be pretty intimidating. So what I want to do is kind of strip it away and just kind of go through, like, what are the requirements, what are the steps, and what could I expect if I were interested in doing this and making it as simple as possible. We've got just read this chat here really quick. Let me get here. Dr. Morrow, what is the role of the board and how does the board affect the work of the health district? What were some of the things they did during the pandemic that influenced the health district's response? So if you'll answer that after, we'll kind of strip it down, go through, like, where do you go to apply? What kind of information do you need? What's the day in the life? Because I think that might help folks to say, oh, okay, I can see myself in that position. I can do that, right? It can be intimidating. It's like, man, I've got to sit next to mayors and commissioners. Like, that sounds terrifying. So let's strip it down. So if you'll answer Jessica's question, then we'll go in that direction.
That's a wonderful question, and thanks for it. So first of all, if you're looking to be a representative for a healthcare or a community stakeholder organization, you probably missed your chance, because we've closed those 2 categories. We're going to leave open the customer of public health category through the 14th of July. So you'll have 2 weeks to apply. A lot of this information is available right there on that website that you're showing. And I think it explains the process for throwing your name in the hat. Typically, we ask a series of questions to establish eligibility, really whether or not a person is a candidate for that position is based on that person's own determination of reading the description of those positions. So that's available on the health board. I like those buttons, apply to join the public health board. I encourage people to pop into that site if they have any interest whatsoever and kind of read the process and understand the new positions. The health board really does drive policy and direction of the health board. So, for example, if the health board wants to tackle a particular issue, they have that opportunity. One of the resolutions that we passed on the health board since I've been health officer was that resolution that that declared racism a public health crisis, and that resulted in the creation of an equity program, which is being run and managed by Jessica Guidry, and she's doing a phenomenal job with that. It allows resources to be directed into looking at those areas of disparity in health outcome, which are really pretty significant. And we're seeing that in Kitsap. And those are disparities in health outcomes that are across the board, across the nation. They are occurring in Kitsap as well. It allows us to address those issues, try to target public health interventions that might help just minimize those disparities. That's the ultimate goal, is an outcome of providing an equitable and equal opportunity for each person who's born in Kitsap to enjoy good health and good health outcomes and lead a healthy life. So that's an example of a health board decision. Yes, if you're on the health board, you get to rub elbows with our local mayors and our county council. I mean, I think that's an opportunity to engage in local politics and help guide and give a little bit of effort to what's going on at the health district. We're going to be relying on our health board for input as we go through our strategic planning process. That'll be a 5-year plan that sets some priorities in direction. And I think there are a lot of areas that need attention in Kitsap. I think, I mentioned that issue with availability of primary care doctors and just access to health care is one big issue. We want to really kind of drill down on that and make sure we understand it and understand where the gaps in access are. There are others as well. There's, a looming epidemic of hepatitis C. We're seeing increases in sexually transmitted diseases across the board. Opioid addiction continues to be a huge issue, and the number of opioid deaths in Kitsap essentially doubled over the prior decade. There's a lot of that going on. There's a lot of public information that needs to happen. We're trying to get beyond being in this just full-on reactionary mode of responding to a really prolonged health crisis, but now we want to get into understanding, what all the collateral damage is. Kids, in particular, adolescent girls have just really had a rough time with this pandemic, and there's a looming, real significant issue with mental health, substance abuse, some of those areas of collateral damage that might be considered, just disorders of despair in a lot of ways. I think this has been a rough time for folks.
Yeah, absolutely. And thinking, I'm glad that you're thinking of all these different things, right? Like, I didn't know STDs were up in the county. I'm aware of the opiate crisis. And so when I see this board formation and this body saying, you know what, we want regular folks to be a part of this board and elevate their voices and their ideas and bring them to the table. I think often many folks feel disenfranchised, and if things are going to change, they have to have a seat at the table, and that's exactly what Kitsap Public Health is aiming to do here. And so, just looking at the site, for the consumers of public health appointee, those who self-identify with a historically marginalized and underrepresented community are desired. And looking at some of the duties here. Non-elected members, they're recruited, right, which is what's happening now, evaluated and selected, and recommended by the health board, which you talked about before, right, with the other 30 or 40 pool of applicants. The board of county commissioners for appointment. Non-elected, non-tribal members must be approved and appointed by the majority vote of the county commissioners. So we're all good with that, right? We've watched American Idol, so we know how that looks. No more than one non-elected member may be selected and appointed for each of the groups listed above. And right now, you're looking for that person in that group. Non-elected members approved by the county commissioners serve a term of 4 years. So when you're thinking about the commitment here, this is a 4-year commitment, and are limited to 2 4-year terms. So you could do it back to back if you wanted to. Following a gap of 1 year after the first two terms, 8 years of non-selected members may be reappointed. So that gets a little bit, more technical if you want to stay involved and really just you love it and you want to keep going. But for now, it sounds like, if this is something that you want to do, you'd be making a 4-year commitment. Let me see if there's some more information here. Non-elected members shall have the rights and responsibilities afforded to the elected members, except that non-elected members shall not be allowed to vote on any decisions related to setting or modification of permit licensing and application fees. Can you talk about that piece right there?
Yes, and so specifically, the health board does vote on the budget. So the budget is something that gets presented. I think it's in November, October, November, maybe December each year. The health board will vote on the overall budget, and that includes the expenses as well as the revenues coming into the health district, but specifically permits and licensing, those are governed by that state law, and we're not allowed to charge excessively. So basically, the fees of permits and licensing and applications they go toward the covering the expenses of the people that are doing that work, and we can't charge more and kind of accrue revenue for that. So anyway, that's why they don't really get a vote in that. Those are typically set internally by the health district, and it may be that the elected members have some input on that. I honestly don't know. That would be a better question for our administrator, Keith Grellner. But the long and short of that is that's a minor issue, and it's not a big concern with respect to voting or involvement. The one thing I do want to say, Marwan, is that we recognize that there are a lot of people out there that have jobs, multiple jobs oftentimes. These meetings are often during the day. I think it's not fair to ask people to come and do this out of the goodness of their heart. So there is compensation. It's an hourly rate, I think, of 75 or 85 bucks. I can't remember, one or the other. Not an hourly, but per meeting rate of 75 or 85 dollars. And we hope that kind of covers whatever lost money or other expenses and other time involvement comes along with this. So there's a small stipend that is associated with this.
Let me give you a horn for that. That's a big deal. So, folks that, in this population that you're looking for, that is one of a huge barrier for them, right? It's like, I love to be a part of this, but that means I got to take time off work, or, someone needs to watch my children. So I can't really participate in this. And so I love this, that non-elected members will be compensated for their time and travel to attend meetings or other official board gatherings in accordance with the board's bylaws. So I think that's fantastic. So if you are considering, uh, being an advocate of health here, know that you will be compensated for your time. So I think that is great. And I'm so glad you pointed that out there. Some of the things that uh, you're looking for, if you're a good fit, incumbents for non-elected, non-tribal board member positions will demonstrate attributes from the following distinguishing characteristics: demonstrated time, expertise, and experience in one of the non-elected member groups, which obviously, if you have been experiencing poverty or low income, or if you're in one of the demographics, obviously that's you're in there already. Service current or past on other local boards or commissions, professional demeanor, and commitment to promote civil discourse. I think we're all pretty good at that. Demonstrated ability to get along with others and possess a working experience to find consensus or compromise. And so, being solution oriented. And many in marginalized groups do have to, find different ways to, not only find consensus, but to get through, right? To make things happen, to put it all together, and a strong understanding and commitment to public health. I would assume that they don't need to have all of these things. They just need to have some of these things. Because, like me, I don't know a whole lot about public health, right?
Yeah, I think ideally, the more of those things you have, the better off you're going to stand with respect to kind of getting through the application process. And like I said, it's been relatively competitive. We could easily take essentially any of the. I mean, the people that are applied in that first round were just all marvelous, and it's you can't take them all if you can only take one. So it's we're looking for people that are going to kind of hopefully bring the full package and add just a lot of value to the function of the health board, and somebody who's not afraid to say what they think, somebody who's not afraid to push borders a little bit, somebody who knows how to go along with a consensus decision and support that decision, even if they didn't necessarily agree with the results of the decision. But yeah, the more of those things that a person brings to the table, the more likely will be to get on that health board. And again, we're really hoping to get some good quality people who can help us move this big boat forward a little bit.
Doc, is it fair to say that, I kind of interpret this strong understanding and commitment to public health? Um, if you're looking for folks from, marginalized populations, how they experience health, right? Or the lack of health or access, education, that's important, right? Because those might be blind spots from someone who sits in the mayor's seat or, a commissioner's seat. Is that fair?
Absolutely. Absolutely. I think that is one of the most valuable perspectives that we really do want to hear. And I think that there is a real need for that. And I think it's a great opportunity. I mean, I'm thrilled to see this rolling along, and really looking forward to adding those kinds of perspectives onto our health board.
All right. And then the last bullets here, I think, again, you're making this as low of a bar as possible, right? Representation of diversity and lived experience, which I just, also spoke about geographically in Kitsap County. So that makes sense, right? It is Kitsap County Public Health. Representation of historically underrepresented populations in the county, right? No significant or ongoing conflicts of interest, which is kind of a basic thing there, and demonstrated commitment to diversity, equity, and inclusion. So I think that's very. I think that's a pretty easy bar to get over there. This is a non-employment volunteer position and is exempt from the minimum wage and overtime requirement of Washington. Uh, and the essential board member functions. I did want to get into this because I think this is important. Adherence to follow and uphold the board's bylaws and public health statutes and rules of Washington state. So if I'm looking at this, I'm like, well, I've never interacted with bylaws. I would assume that through meetings, conversations, I can ask questions. I don't have to be fearful that I don't understand what bylaws are and whatnot. Is that fair?
Well, so we're going to do a orientation for all new members of the health board, and I think that's going to be a really important process. Actually, on the Kitsap Public Health District website, there is a health board page, and it runs through a lot of the different kinds of issues that health board members need to be aware of. Whoever gets appointed and selected and appointed for this health board is going to be, it'll be a learning process. It's a learning process for all of us. I mean, we're all still learning, and that's a good thing. I mean, that's why these positions are so interesting and important, really. But there's a list of things that are required under Washington state law that public health jurisdictions like the Kitsap Public Health District are all responsible to make sure happen. So that's kind of part and parcel of what needs to happen. And then there are those other areas which are more broadly mission oriented. So our mission is to protect and promote the health of all persons in Kitsap. I mean, that's a big charge, right? I mean, that includes everything from health literacy to built space environment, thinking about parks. It has to do with car safety, it has to do with food safety. Restaurant inspections are a big part of what we do. We monitor the swimming beaches and the swimming pools to make sure kids aren't and families and people in general aren't getting sick from doing those kinds of activities. So the drinking water is part of what we regulate and what we take care of looking at. It's things like pandemic, it's things like infectious diseases, sexually transmitted diseases. There's a huge list of notifiable diseases. You might have heard that we have a couple flocks of birds in Kitsap, one of which just tested positive for what's called highly pathogenic avian flu. So
No.
yeah, we're dealing with that kind of thing over the holiday weekend, Marwan. That's kind of the sort of stuff.
Wow, there's a lot going on, right?
It's endless. It is endless, and we're a tiny little organization, and we're tiny, but we're strong and we're effective, and we have just absolutely marvelous human beings doing this work, and it's incredible. I see it every day how efficient and effective people are. We've got a team who's managing really just crazy complicated tuberculosis with really kind of spooky drug resistance patterns that are having to require a lot of work on the part of our communicable disease teams. And then there's the whole piece about communications. How do we get the message out? How do we do it most effectively? Who are the target audiences? We've got an epidemiology team who's looking at and tracking just vast amounts of data. And we're really trying to, tease out those key nuggets that we feel like are really important and getting those put in their proper context of why is this happening and what can be done about it and how important is it? How do we fix it? So there's an endless variety of really interesting challenges, and anybody that joins on with the health board is going to need to, be looking at this issue from a high level policy perspective and help and guide our direction and make sure that we're stable and well funded and that we can use our resources as effectively and efficiently as possible.
So, I appreciate Jessica in the chat, and what she's sharing is there is actually a board meeting next Tuesday. So you can watch it via Zoom or BCAT or Facebook Live to see how meetings are run. So if you're thinking about it, it's like, hey, I want to, but I'm really not sure what this looks like. You'll be able to tune in next Tuesday and check that out. So I definitely want to show people where they can find that on the website. If you can share that, Jessica, just put that in the chat and the time that they can tune in and watch that. And then she also says at next week's board meeting, there will be updates from our food and living environment program, Nurse Family Partnership, and Dr. Morrow and the administrator, Keith Grillner, will also give updates. So this will be a great time to really get an experience of what a board meeting looks like and see if that's a great fit for you. And so let's go back here to the top, Doc. When is the deadline for them to apply? Is this current up here, July 8th? Accepting through July 14th.
Yeah, I think it's through the 14th. So folks that are interested and who are self-designated customers of public health have 2 weeks to get their application packets in. And And I encourage. We'd love to see a lot of them, and and then we'll be trying to get those applications in front of the personnel committee of the health board. So on the health board, there are different committees. There's the finance committee, there's the personnel committee, there's the policy committee. All of those are really important kind of subcommittees of the health board, and help give us a lot of guidance and direction as staff, um, and I'm an employee of the health board, so I do what they tell me to do.
Absolutely. And I'm pulling up here the application just so folks can see that. First question here: do you have a disability as defined by the ADA that you are requesting accommodation? Yes or no? Again, here's the deadline, July 14th. So you got 2 weeks, 13 days from today. If you have any questions, you can contact Karen Holt at karen.holt@kitsappublichealth.org. If you have any questions or need any help with filling out this application, you can also email pio@kitsappublichealth.org or call 360-728-2330. And you're just entering in your name, your address here, home phone, work phone if you have it, cell phone if you have that, an email address, a physical home address is required if different from above. Are you a resident of Kitsap County? Obviously, you need to answer yes to that if you're going to be on the board. Are you available to attend regular board meetings? They are here's my answer right there. The first Tuesday of the month, between the hours of 10:30 and 2 p.m. Meetings start either at 10:30 a.m. or 12:30 p.m. and generally last for about 90 minutes. And so you can select one there. Here, consumer of public health, individuals who reside in Kitsap County and self-identifying as having faced a significant health inequity or having lived experience. That's a yes or no question. Do you identify with the consumer public health category? Yes or no? Please explain why you self-identify as a consumer of public health, which I think is pretty easy to do there. Please list and describe any training, education, life experience, or work experience. I think the life experience is kind of the big one there. Uh, any licenses or certifications that you may have that might be relevant. And you can use extra pages. So if you print this out and you write like I do, and you can only get 2 lines there, you can add extra pages there and just number it number 8. Have you served on any other community or nonprofit boards or commissions? Do you have any other volunteer experience? Think back because a lot of us have volunteer experience. You know, you may have helped in a soup kitchen or done a lot of different things. So think about that. Do you have any conflict of interest defined as any activity or interest that exists or arises that personally benefits an individual, results in personal gain for the individual, or an individual becomes unreliable because of a clash between their personal or self-serving interest and the duties and responsibilities of the organization they belong to. So, like me, I have a relationship with Kitsap Public Health, so I would not be able to serve on the board, right? So that's a tangible example for you. Do you have a potential conflict of interest with the health board or health district? And then you can answer that below. And so I would assume if you don't, then you just say, no, I don't. That's it. Or NA, not applicable. Applicant certification statement. By signing this, you are certifying that everything that you are saying is true. That's it. And your date, hit submit, boom, goes the dynamite, as they say. So I think that's pretty simple there. Did I miss anything? Did you want to add anything to that, Doc?
No, I appreciate you going through that. I mean, it's as easy as that. And if you're thinking about it, go ahead and do it. Don't rule yourself out, Marwan. I'm not sure why you have a conflict of interest, but if you're on the fence and you want to join our board, throw your name in the hat, and we'd love to see you do it. But no, I appreciate you going through that. We're trying to make it easy, low barrier, and a reasonably understandable process.
Well, in all transparency, what I would tell the audience that I won't apply, and the reason why I wouldn't is I believe in diversity of thought. and I have an elevated voice, and so part of the conduit is trying to elevate as many voices as possible. And my voice is heard in a lot of different arenas already. But it would be an honor to serve on the board. But diversity comes from having more voices at the table for sure. So again, I want to share with everyone where they can get this information. All you need to do is go to the Kitsap Public Health District website. I'm going to put that in the chat there because we want to make it as simple as possible for folks to get there. So again, you can just type in kitsappublichealth.org. And once you're on that main page, let me just go ahead and zoom in on that again. You're on the main page here. You will see, well, actually, that's not technically the main page. This is the main page, kitsappublichealth.org. I actually took you to the second click. So let me rewind that so no one is confused there. So you're just going to kitsappublichealth.org. And if you just scroll down right on that main page, you'll see it right here with the building, Kitsap Public Health Board Expansion. Go ahead and give that a click. And that's going to take you to the link. All of that information that we just talked about is right there. So if you want to look at that position description again, it's there. That application form is there. It's also in Spanish. So that is fantastic. And then if you have any frequently asked questions, that is there for you also. Again, please join and check out the board meeting this Tuesday, which I believe is at 10:30. And Jessica put all of those different ways that you can access that. Oh, she even put the Facebook link in there. So you can watch the board meeting, get an idea of what it looks like, and really consider it and apply, because your voice needs to be heard, and the change that we want to see is only going to happen when all of us are part of the solution. And Kitsap Public Health is trying to ensure that we're all part of the solution. So I definitely appreciate that. So Doc, I'm gonna give you the final word here. Thoughts on July 4th safety? That's a public health thing. I mean, health is everything, right?
Don't get sunburned, I guess, is one thing. Don't get your fingers blown off with a firecracker. That's another. I mean, use common sense. One thing that we do know in public health is that as the days get longer and the weather gets better, and we're kind of coming out of a sort of a prolonged isolation period, that kids in particular tend to take a little bit more risks, with respect to drugs, alcohol, sex, driving habits, what have you. Think twice. Go a little slow. Be aware that this is a potentially dangerous weekend. Our emergency departments are already a little bit strained. I think I mentioned that earlier, just based on the fact that visits are high right now. And take good care of yourselves. Stay safe and enjoy friends and family. Have a good time, but just take it easy.
Take it easy. I love it. Well, since you say you don't get applause very often, we got to give you some more applause there. Hit you with the horn. We appreciate you. Thank you for your time. We hope that you have a blessed and safe 4th of July. Also, again, kitsappublichealth.org. If you want to get involved, this is the way. And even if you don't want to be on the board, check out the meetings, right? I believe there's probably opportunities for open comment. So let your voice be heard, whether you join the board or not. But as you can see, it is very accessible. You can do this. There's compensation for it. So I encourage you to strongly consider it. So for Dr. Gib Morrow, I am Marwan Cameron. This is The Conduit. Be good to each other. Have a good weekend, everyone. Bye-bye.